Okay, so in terms of the numbers of COVID-19, it looks as if we've been through the worst of it. The numbers have definitely come down significantly. You can see the number of deaths per day, the number of new infections per day. So it seems as if we have reached that peak and now we're in a bit of a lull with new infections. The problem comes in with the assumption that we are now, or that COVID is over, and that we can now let our hair down, as it were, we can let our guard down, as it were. And if you look at all the countries who had their peak early on before us, they are all experiencing what we call a second surge. In some cases, it's even worse than the first. And so this is my fear, is that South Africa may prove to be no exception, in that in a few months' time, we probably will see. And some of the GP networks in our area on the West End are reporting some increased cases in Gauteng, which means that the surge may be starting already. So there's no point in taking off our masks, in stopping everything else that we've been doing, especially with regard to social distancing and the hand washing, and thinking that we can now just carry on, life is back to normal. Life is not back to normal. We may well experience a second surge within the next few months. So kids and COVID has been very, very controversial over the last few months. But I think we need to remove the emotional aspect and look at the data. And what the data has clearly shown worldwide and even in South Africa is that kids form a very, very small part of the pandemic. Kids don't get as ill as adults do. Very, very few kids die from COVID compared to adults. And if you look at the data amongst the kids who have died, they almost always have pre-existing or comorbid conditions. In other words, healthy kids who get COVID do not die. It's the ones who have pre-existing cancers or type 1 diabetes who are at risk of serious disease. Interestingly, asthma doesn't fall into that category. So kids and asthma are quite okay with COVID. And so from my point of view and my opinion is that kids need to be at school. Kids are not going to bring the infection home. Kids very, very seldom infect adults. They may spread it among themselves. Teachers do not give COVID to kids, very seldom. And our kids stay healthy. So kids need to be in school. They need that social interaction. They need their education. And they need to be outdoors compared to, especially during the worst of the lockdown. So for me, kids and COVID are not such a big deal. So the long-term effects of COVID are, at this point in time, not actually accurate in terms of knowing where we are. It's a new disease, a new pandemic. Data is still coming in. But I can tell you what we are seeing is that while you may have recovered from COVID-19, does not mean that you're actually better. So you've recovered in terms of time, so you're allowed to leave home now, you can get back to work. But there are many patients who are still ill. They're still in the sense that they feel tired, they tire easily, shortness of breath. Some may not have gotten their sense of smell or taste back. And it reminds one very this condition that was very topical a few years ago, yuppie flu or myalgic encephalitis, chronic fatigue syndrome. Runners can't run anymore, chest pain, lung issues, persistent cough. And so we've even coined a term for it now called long haul COVID. So this is this post-acute, you've had COVID, you've recovered, but you're still battling with a number of symptoms. And so this is an area that needs to be studied. We don't even know how to manage it. It's probably just conservative or supportive, and making sure that the patients understand. And doctors is very important. We can't tell patients there's nothing wrong with you or it's just in your head. It's not in your head. This is something specific that patients are feeling. And so lots of research needs to go into it. We need to study this in depth so that we can see how bad it is. And will patients eventually recover, or is this going to be a feature of their lives for the rest of their lives? So once you've recovered from your COVID in terms of time, remember from day 9, since the beginning of your first day of symptoms, you still have the virus, but there's very little shedding, okay? Which means that there's not enough virus in your system for you to be contagious. So even though you may still have symptoms after your 10 or after your 14 days, and even though 2 or 3 months later you are still ill in the sense of shortness of breath or tired, you cannot pass it on. So you are no longer infectious. Thabo knows there is no evidence that mosquitoes spread COVID-19. COVID-19 or SARS-CoV-2, the virus, is a respiratory illness, which means it is spread mainly by respiratory droplets, so by coughing, sneezing, and talking and singing, hence the importance of wearing your mask. COVID is not gone, okay? The numbers have come down. And remember, just because we are now at alert level 1 and most of the restrictions have been lifted, is not the same as COVID is gone. These are things that have to be done in order to maintain the economy and to restore some level of normality. COVID is going to be here for a long, long time. Maybe not as bad as it has been. And so what we are saying is, as much as the numbers are down and things are opening, one has to be on guard more than ever before, which means, I talk about my 4 W's: wear your mask, wash your hands, watch your distance, and keep your windows open. Zintle, in terms of a vaccine, we are getting there. I can tell you we probably are not going to have a vaccine this year, probably by the middle of next year. So vaccines have been developed. They are now in what we call phase 3 trials, which means they are trying to see how safe they are. So it's no use having a good vaccine, but you're going to die of something else, or it's going to give you another illness. We have to make sure that it's safe. So this is why there are a number of trials going. People have been enrolled to receive the vaccine, healthy individuals, to make sure that it does not give you side effects. So watch the space. We are going to have a vaccine, but not really now.